Out of respect for your time, I am going to go ahead and get us started. If you would advance to the next slide, please. Hi and welcome, everyone. I'm Laura Wheeldryer, Executive Director of Maryland Family Network, and I am so glad you are here with us today. Today's sessions are the culmination of our series of online forums for childcare providers, and I'm thrilled to say it has been a really successful series of events with 100 to 200 people on every single forum, lots of great information exchanged, positive feedback, and I think some important collective learning. I fully expect that discussion today to be perhaps our most critical discussion yet. Epic lessons learned. See the play on words there? We're going to hear from health experts today, as well as providers who've been open and serving the children of essential personnel. We will take your questions, and we look forward to a lively discussion. Before I turn it over to our panelists, I just want to note two quick things. First of all, this conversation today from 4:30 to 5:30 p.m. is focused on center-based providers. So I just want to make sure we're all clear on this, that this is a conversation focused on center-based providers. Somehow, at some point, we inadvertently switched the times. And so today at 4:30 is center-based providers. At 7 p.m. tonight, we will have a similar forum for family child care providers. Apologies for any confusion, but this is the conversation focused on centers. And second of all, I would like to note, while we appreciate the dedication and support of MSD during this unprecedented and rapidly changing pandemic, this particular event is not sponsored by, nor do we represent the opinions of MSDE. So I just want to emphasize to providers on the call, or the webinar right now, that this is a safe space where you can share openly and have respectful, constructive conversation around best practices, lessons learned, and hopes for the future of the field. So, all of that being said, on behalf of everyone at the Maryland Family Network, I want to thank the child care providers of Maryland, who are themselves essential personnel. The work you do is essential to each and every one of us on this call, in this state, and in this nation. We thank you, and we know that a booming economy, thriving families, and flourishing children are only possible through the important work that you do every day. Thank you so much. I look forward to the conversation.
Thank you, Laura. My name is Steve Rody. I'm Deputy Director at Maryland Family Network. We have a very full agenda and a lot of really good information, so we're going to get started right away. A couple housekeeping things first, please. Number one, if you have a question for the panelists, go to the bottom of your screen and look for the Q&A here. This will let you ask questions that you want the panelists to respond to. If you need the moderator, you want to go to the chat box, and the moderator is if you're having problem hearing, if there's a link you need, any of that type of information. So again, a question for the panelists, please go to the Q&A. Likewise, as Laura mentioned, we are not MSDE, and MSDE has a lot of really great information on their website. This is the link to it. Lacey, who's our tech person, is going to put this in the chat box so that you can click on it and be able to access the information. We recognize people are also interested in training certificates, and we will issue training certificates for this session. As it says here, we will issue for 1 hour. That's assuming people are on for the entire length of time. As you know, MSDE does keep track of that. They ask us to keep records of it, and we will issue certificates for those of you who have joined us for the entire time. And as you can see here, these certificates will be mailed out to you by July the 10th. If you have any questions about this or anything else, go to mccrninfo@marylandfamilynetwork.org, and again, we'll put that in the chat box. So let's get to it. Coronavirus has impacted every one of us, whether we're a child care provider or not. What we want to do today is talk to some programs and some experts who have information on this to help us look at this and help us to put together our practices in a more efficient manner vis-a-vis the coronavirus COVID-19. We're very pleased to have with us two physicians from the Department of Health, Dr. Cheryl DePinto and Dr. Jamie Perry. And Drs. DePinto and Perry, I'm going to turn it over to you now, please.
Thank you, Stephen, very much. And thank you, everyone, for having us to speak with you this evening. I'm Dr. Cheryl DePinto, and I'm a pediatrician, and I work at the Department of Health in the Office of Population Health Improvement. I'm one of the people, in addition to Dr. Perry, who's been working on the COVID response, in particular response related to children and pediatrics, as well as childcare. So when we think about what's happened with this COVID pandemic, one of the things that we have been very, very keenly aware of is the fact that school closures had a significant impact on children, families, and communities. In addition to that, as you may or may not have seen from the CDC website and other sources, there's a lot of data out there. And the data related to how COVID-19 affects children continues to emerge day by day. The symptom list grows every day. The fact that commonly children have very mild illness, that for a long period of time, it was very difficult to have children get tested, although that has changed significantly now. And there's also been a lot of debate as to whether or not children are carriers of this virus or whether children get primarily infected by adults around them. Those issues, as well as issues related to primary care providers being able to keep their practices safe in the early stages of the COVID pandemic, made it very challenging to address the issues of children. So as part of what we've done with childcare is we've considered all of the scientific evidence, and we've worked with a number of agencies, MSDE included, and we work to develop guidelines and guidance documents to guide childcare during this pandemic when childcare was closed and certain centers and family childcare sites were open to provide care to essential personnel. As we think about how the guidance documents were developed, many of the things that we considered were things related to the epidemiology of the virus and how it was spreading within communities, how well testing was accessible to children and families, the capacity of communities to do surveillance and contact tracing, and then keeping abreast of the emerging data around the impact of COVID in children. And with that, I'm going to turn it over to Dr. Perry.
Thanks, Cheryl. Good afternoon, everybody. This is Dr. Jamie Perry. I'm the medical director in the Office of Healthcare Quality, and like Dr. DePinto, I'm also a pediatrician. I'm happy to be here this afternoon. Given what Dr. DePinto has said and the seriousness of the COVID pandemic and its impact on the Maryland public and the community, this has really required us to think about what extra measures, in addition to what childcare providers are already used to doing, to ensure the health and safety of the children in their care as sites have opened up to serve the children of essential personnel. And we know that childcare providers already do many things routinely to ensure the health and safety of the kids in their care, as well as the staff. But the seriousness of the pandemic has really required us to take some extra measures. So very quickly, I just want to give a very high level overview of what these measures are that we're asking providers to implement. I'm sure you'll hear more details about these from the other speakers. First of all, we're asking providers really to strengthen their communication with families. We need you to help families understand what measures you're taking and why, and they really also need to understand their role in helping you make sure all the children and staff remain safe, particularly in terms of the importance of communicating, family communicating with providers about symptoms and illness in their children, household contacts, and other exposures. We're asking you to implement social distancing. So just like in other areas of your life, we need there to be social distancing in the childcare setting to reduce close, prolonged contact between people to decrease the potential exposure to the virus. So this is not only finding the best ways to keep at least 6 feet between children and staff, although we know that's not easy, but also keeping small groups of children and staff together and not allowing groups to mix. So if someone does become ill, fewer people are exposed. We're asking you to implement active screening for illness. So we're asking providers to screen children and staff when they arrive at the program to see if they have symptoms of COVID or exposure to people with COVID symptoms, and also to do daily temperature checks. And the goal is to really identify people with possible illness early and keep them from entering the program. We're asking you to up your game in terms of cleaning and disinfecting. So enhanced cleaning of frequently touched surfaces, especially toys and games. For centers, it also means more frequent cleaning of shared spaces like bathrooms and cleaning between use by a classroom, or cleaning after a class uses the playground. And then more frequent hand hygiene, more frequent hand washing for kids and staff. We're asking just a couple additional things. We're asking for providers to implement the use of cloth face coverings in their programs. So staff and children over age 5 are recommended to wear face coverings while in the facility as long as it can be done safely and consistently. And then lastly, we're asking you to follow certain procedures when there's a child or a staff member who has symptoms of illness that could be COVID. That involves isolating the sick person until they can be picked up if they're a child, consulting with the local health department and your licensing specialist, and in most cases, closing for a period of time for cleaning and assessing next steps. All of these areas that I've very quickly outlined have detailed guidance related to them that can be found in the link that was provided at the beginning of the webinar on the MSDE Office of Child Care website. Thank you.
Thank you. Before we move on to our other panelists, there was a question. If you see me looking off in the distance here, I have another screen on my left here. Dr. Perry or Dr. DePinto, could you reiterate what the protocol for children wearing masks in the classroom is?
Sure. Our recommendation is that for children over age 5, that they should wear cloth face coverings while in the facility as long as it can be done safely and consistently. And there's very detailed guidance with a number of considerations and instructions for safe and consistent use. We recognize that not every child over 5 is going to be able to wear it safely and consistently. So that guidance will be very helpful to help you make a determination about that.
Thank you. And as Dr. Perry mentioned, and this is in our chat box, I'm looking at it, the guidelines that MSDE and the Department of Health have worked on jointly are available at the link that we have in that chat box. So please make sure, if you've not looked at that link, if you've not clicked on it, please take advantage of it. There's very good information there, and it is updated on a regular basis. The other piece that I'm looking at here, the question, how can we social distance 2 to 4-year-olds? And I think our panelists are going to talk about that. And if we don't get to that, we'll reorient ourselves at the very end for the questions and move on to that. So we have a really great panel. And our first panelist is Imani Angela Rose, who operates a program called Joshua's Place Early Learning Center and Enrichment Center, excuse me. And Imani is not only a qualified child care director and teacher, she's also a registered nurse. So Imani, can you share some of your experiences with us, please? Remember to unmute, please.
Yeah,
Thank
sorry
you.
about that. Good afternoon. I'm excited to be here and talk about my experience as a EPIC site, as well as my view of how to manage in childcare, even being an RN. What I would like to say is the whole experience of this whole EPIC site and the pandemic was very stressing, if nothing more. I think just the stress of all the unknowns, and we know that the guidance comes from what they have available. And because this is a novel virus, we just didn't have a lot of information, and so they don't have a lot of information. So we're doing our best with guidance to try to make sure that we're following the protocols so that we don't pass this virus along to children or families that we are serving. I would just say that not only is the health aspect was stressful, it was also just understanding or misunderstanding of communication between childcare and MSDE at times, with things changing so quickly. Some of that to be expected, but at the same time would feel like if they would have, okay, before you put one thing out, can you really make sure this is where we're going to go, and then let us know. And then not always having the best level of communication. We were getting information from I actually also worked on a lot of the work groups. I worked on one of the work groups for the reopening. So we might hear and talk about one thing there, but our licensing specialist may say something different. You have to go by what also you hear from the governor and then from the mayor for Baltimore City. So it got quite a bit taxing and trying to manage and stay up to date on all those things. I'm grateful for the guidance and the guidelines because they do put them up and they do update them. So that is the best place to go and find out what you need to do. Now, in reference to actually running your day-to-day program with the children, I'll say 2 to 4 year olds is very, very difficult to socially distance. What I would say is we are Christian centered, so we used to hold hands and pray. So we had to change that and have to do things like we just put our hands together as if we're praying. And then I taught the children about social distancing as best I could with, they would have to spread their arms out so that they could make sure they couldn't touch their neighbor. And so there are times where we just reiterate doing that type of practice. It doesn't last long. The kids, once they get to playing, they start playing and they go from, they may have their particular area and then another child has another area. And then maybe some when they're in like, we have a table of activities and then we have our floor activities and we spread them out. Depending on the table activities, they pretty much stay socially distanced. The ones on the carpet or on the floor activities, it's so very difficult because they just get up and go. And the 2-year-olds don't stay anywhere. They just go where they go. As developmentally, they can't do it. It's not even appropriate for us to think that they could do it. So we just do our best to try to find different activities. Or at my center, I have siblings. So they may play with their sibling more so than they ordinarily would when we were just open as a regular center. I would have to say, as far as face coverings for children, our little ones, they did come with them initially. They started off with them. As time went on, they kind of did not have them anymore. One, they would not keep them on. It wasn't a feasible thing. And even if they did have them on, they're not all the way on. They may be on the floor. They're getting dirty. Like it just was not a good thing to be able to try to manage. It was very difficult. And I would say kids who are 5 and up, so you're looking at like school age wise, even if some of them could tolerate it for longer periods of time, they themselves felt uncomfortable in them, so they did not keep them on. Some of them do have asthma, so they couldn't keep them on. Some have just allergies or other issues that's going on, and they just couldn't keep the mask on. So I have children who have the mask, but for the most part, many of them are not wearing them for a variety of reasons. The staff, we wear our mask all the time, all day long. And the children, the little ones, especially the 2 to 4 or 5 year olds, if something goes on, they're always right up under you. They're tapping you and they're calling your name or they're coming to you. So we can't socially distance ourselves in any real quantifiable way all day long with the children. And I know that it's not necessary, it's the best scenario, but it is not likely that can happen on a regular basis. And it's not even a realistic expectation, honestly, in the development of children for them to be able to do it. But we still will reinforce things. And there are times if we're doing something that's quiet and we're all sitting, I will reiterate, move over a little bit, stretch up past, straighten your arms out so you can see that you're not touching your neighbor. But for the most part, that's how we manage the social distancing in the center in our day-to-day activities.
Imani, can I interrupt for a minute? Because there was a question that came up. So given what you said about social distancing, and I'm sure each of our panelists has a story about that, how they implement that, and you went on to describe that. So given that it's almost impossible, especially at younger ages, to social distance, do you have any protocols in place for your staff in terms of more frequent hand washing, changing of clothes, anything along that line? Is there any advice you can give us on that, please?
So as far as the hand washing, I think, so the guidelines came out and said that we need to wash our hands more frequently. And I think in a typical center that's doing what they're supposed to be doing, we are already washing our hands frequently. I think one of the biggest things was just to ensuring that my school agers understood they needed to wash their hands for 20 seconds. And with the children, the younger ones, the 2 to 4 year olds, we really, really implemented the song that we sing, which is the ABCs, but we say it a certain way, that they say it that way and they wash their hands. If they cough, if they sneezed, if they, any of those things. And if it's on a particular item where they were on the floor playing with it, then we remove that item. It will get sanitized and it may come back out in the afternoon because it's been sanitized and sprayed down. But other than that, we practice regular hand washing and washing as necessary with what we would normally do. We're not taking them in the bathroom every 2 hours or every hour. We're taking them as they normally need to be washed and sanitized. Because even here, we already washed hands. If you wiping your nose, let's go in the bathroom and clean your hands. And even though nothing may have gotten on their hand, they use a tissue, we still want to go wash our hands. And we go and we make sure that they're washing their hands. I think the biggest thing is finding a way to make sure your kids are washing them for 20 seconds and getting a good sud, get some good soapy suds and friction so that they are not only killing the virus, but also washing it away.
Okay, thank you very much. And I know you'll stay with us for questions at the end. We
Yes.
appreciate that perspective that you have. Our next presenter is Tracy Jost, who's with the Kids Campus Early Learning Center in Southern Maryland. And Tracy, can you share with us some of your experiences, please?
Sure. Thank you for having me, and thank you, Maryland Family Network, for supporting us providers through this crisis. You've been a great help to us. My center's in Southern Maryland. We actually have a lower rate of cases in Calvert County than some of the other more populated counties have. So I just wanted to start with that. Not that it matters, of course, but it just gives you a different perspective, I think. My center serves infants through age 12. So, that was definitely a concern when we first opened, of course, were our infants. And when we first converted over to be an essential provider site, we saw limited infants coming. We usually have 2 infant rooms that serve 6 children each, and we're currently only operating 1 room at the moment. So we are beginning to see more and more parents go back to work and inquire about care. Initially, we did all the extensive cleaning and protocols. I will agree with everything Imani said. Her experience is very similar to ours, as I'm sure Hilary will probably say as well. It was very stressful in the beginning. We didn't have a lot of guidance to start, so that was a little concerning. And then as the guidance came out, it changed over time. So when we first opened, we just went on a cleaning frenzy. We came in on the weekend, we cleaned everything, bleached everything down. And we have even though we do our own cleaning, we also have a cleaner that comes in on the weekend to clean behind us. We changed all the air filters and the ducts, just made sure everything was, had new air purification in it. We actually, because my parents own a heating and air conditioning business, we put in an air purification system on every single one of our units, which is not cheap. It was expensive, but it was just another protocol we thought that might help us out. One of the suggestions that was provided to us from another provider and really helped us out with our playground routine was they make these commercial grade pest control sprayers, and we filled it with bleach and water. So you can get those from like Home Depot or Lowe's. And then we spray down every time a classroom goes out to use the playground equipment, we spray it down with this bleach and water solution and this commercial grade pest control sprayer. And that really, helps. And then if anything needs to be, we let it air dry in between switching, the next group out to use the playground. So that has been helpful to us. I will say I agree with Dr. Perry in that making sure your families know what their expectations are. We actually did a FAQ protocol sheet. I'm sorry if you hear background noise. I am at my center, so there are children passing by. So we did a FAQ sheet for any family that was returning to let them know what are our protocols in terms of temperature checks. We also provided guidance that said if your child has a normal illness that normally would require a 24-hour return from care, we increase that to 48 hours. We let them know that if a sibling were to have a fever or to get ill at the center, both siblings must go, not just one, things like that, just to disclose up front. We let them know that those are health department protocols to keep everybody healthy. We ask them to disclose to us, even though we ask in the morning along with the temperature checks, any symptoms, but we also ask them to disclose to us if they've come into contact with anybody in their workplace or any other place in which they might have had an exposure. So just being upfront with your parents on what your protocols are and what your expectations are. And I think if you give that to them at the onset and then as they return to care, so that they are aware these are what our protocols are and what our expectations are of you and what we're doing to try to keep everyone safe. We also did the same thing for any newly returning staff. And I think that's important to what Amani said about the stress. It is stressful. And so as people return, both parents, children, and staff have anxiety. So I really think supporting that social and emotional health is really important. Making sure you're communicating, finding ways to support your staff to reduce their stress level. Some of my staff stayed on while we converted to essential personnel providers. Some of them we furloughed because they were in the high risk category. And then some of them chose not to work on their own, but then returned later. So just trying to figure out where everybody's stress level is and meet people where they are, because we all have anxiety as we watch the numbers. I have a little anxiety right now watching what New York and New Jersey are doing about people returning from Florida and having a 14-day quarantine, and wondering if we're going to get some guidance on that from the health department as people vacation and then return to our programs. So, things like that are really important to think about. We did have a staff employee that got a fever, and we reported that to our local health department. That required us we had to close for 4 days while the employee was COVID tested, and we had to wait for the COVID results. Some COVID results come back quicker than others, and we were told by the health department it normally depends on the lab that's reading the results or how many people had been tested in that day, because it's my understanding that you go into a pool of everybody that's been tested in that day. So we had to close for 4 days. And that was, a little anxiety producing too, because parents will email you and they'll want to know. We said full disclosure, this is why we're closing. We will let you know, please social distance until we have the results. And as soon as we have the results, we'll let you know. Thankfully, it was negative. So that was good news, but it is, it's anxiety producing. I think over time, and as, children return to school, students return to school in the fall, whatever that's going to look like, we will see more and more of that probably. So I think you should prepare for that and don't think it's not going to happen to your program, because more than likely it probably will. So you should have a plan in place for that. Okay. We also supported school-age students through virtual distance and social distance learning while they were still in school. We had some lessons learned about that, including relaxing our technology policy a little bit, allowing students to bring in their devices so that they could work and do their schoolwork. It's important to remember too, in supporting students with special needs, that they're used to having routines and, being out of your routine and transitioning from being away from home for a long time or being away from school for a long time. We saw a little bit of issues with that. So we used our CEFL strategies to support our students that were students with special needs. We also had a pre-K expansion grant, and we had to move to distance learning ourselves for our pre-K students that were not essential personnel. And so we did a lot of family engagement work to send home lessons, our pre-K lessons via email. We did some videos. We did some Zoom webinar calls with the children, which were very interesting because, you know, they really just want to show you everything in their house and say hello to their teachers and their friends. But after a while, we got better at that. So that was another lesson learned, I think. And just, you know, just really just trying to be open and communicative, making sure that you share your policies, your protocols up front, and then also just making sure that your families are aware that you are doing your best to support them while they're working, but then also keeping everyone healthy.
Great. Two questions, Tracy, if I may, please. Number one is, how do masks and children, how does that work out in your program?
I would say we had the same experience as Amani. When all this first happened, we had so many families withdraw from care. We normally serve on a regular day 150 students, and we had a third of our families withdraw from care, which was, you know, financially devastating, as many of you know. So in the beginning, we had one of our employees has a wonderful skill of sewing, the lost skill of sewing. So she came and she actually brought her sewing machine in and made all of our staff cloth-made masks, face masks, and the children as well. So the first week we really made it into, we were going to be superheroes for the week and we were all going to wear our masks. But I would say my situation was very similar to Amani's, where the novelty of that wore off. It became harder for children to not wear it and remove it, wear it and remove it. And then it became more of an issue of, you know, everything Amani had previously spoke about. So we actually, our children have the option to wear them and most of them do not wear them. We try to do all the social distancing protocols. I will agree with Amani, it's very hard to have 2-year-olds not want to play, you know, and touch one another. But we do lots of hand washing, more so than we did before. We always bleach the toys, and if they mouthed a toy, you know, bleached a toy. So just keeping up with the cleaning. We have a floater sub whose job it is to basically walk around the center and clean all the common areas, the high touch areas like the doorknobs, you know, the door entryways where we're going in and out of, anything that were high touch areas or common areas. And we clean the bathrooms, the toilets with bleach and water after every use.
Okay. And then there was another question very specific to when you closed for the possible case, and that is, did you reduce tuition for those 4 days? How did you handle tuition?
Mm-hmm. So we didn't. Well, and let me preface that by saying that all the families that withdrew from care did not have to pay. Actually, at that time, we were essential personnel, so we were actually getting paid by the state. And luckily, because we were closed for 4 days and not 5, we actually got paid for that week. Had we been closed 5 days, we would not have gotten paid. So because they have to come at least 1 day in order to get payment. So we were actually paid during that time from the state. But with tuition, we did reduce our tuition by $100 per child per month for any family wishing to keep their placement but not send their child. So before we had the essential personnel payments and before we had payroll protection, which we were fortunate enough to receive, it was really week to week. And MFN has a survey about that on, you know, the financial hardships of childcare programs. And really it was those parents that chose to keep their placement with us and pay that reduced rate that really kept us alive. So, and I really think that speaks to the relationship building that you do with your families and the fact that they want to stay with you even in a pandemic.
Thank you, Tracy, and I hope you'll be able to stay with us for the question and answers at the end as well. We appreciate that perspective that you shared. Next, we have Hilary Roberts-King, who's with the Downtown Baltimore Child Care Center, and she's going to share some of her experiences with us. Hilary?
So thank you, Steve. Downtown Baltimore Child Care has 3 centers in Baltimore City. We have a center on the University of Maryland Hospital campus. We have a center at the Homewood campus of Johns Hopkins, and we have a center in East Baltimore near Johns Hopkins Hospital. So I don't want to repeat what Amani and Tracy have so eloquently spoken about, but we did reopen on April 1st. There was a lot of anxiety at first about, what was care going to look like. We had done all the same things as Amani and Tracy. If I had to say one thing that I think is really keeping us safe, it would be screening questions is the first thing that I think is keeping us very safe, and cloth face coverings would be the second thing that I think is, really helping us maintain safe, healthy care in the face of this pandemic. We do our screening questions on the parents' phones so that they have them answered when they come in, because next to certain questions, we have attendance denied if the answer to the question is, yes, there have been symptoms. Yes, I gave my child ibuprofen, which might be masking a fever right now. Even though I just gave it to them because they were teething, the answer is attendance denied. Mm-hmm. So having those questions go out to the families while they're still at home, and then the data comes back to us, we verify the answers to the questions when the families are here at the center, and we verify the temperature as well. But that has been truly, it makes the parents more of a partner in making sure that they're keeping our risk low, and also for their child, keeping their risk low. Also for the staff to know if they wake up and they have, this symptom, they shouldn't come to work that day. It shouldn't occur to them later. Every single day, everyone who works in the center has to answer these questions. And it has stopped people from coming to work, and it has stopped people from coming to the center for not things that were COVID related, but for other things that help us know. When a symptom does come up, I can look back at the data and say, oh, that symptom was not there yesterday. It is here today. Mm-hmm. One of the questions that you get asked when you deal with your local health department is, when did symptoms start? And it really helps answer those questions.
So Hilary, one of the questions, excuse my interruption, mm-hmm. I'm terribly sorry, but one of the questions, and I'm sure it's more than one person thinking about this. What's the system that you're using to have the questions go out to the parent's phone?
So we have the screening questions on Google Forms, and then we use the free texting service of Remind to send the link every morning. It comes, every morning I see them go off at 7 o'clock. They're scheduled. They go to all the staff and all the families. And then we can review them. Anyone on my administrative team can review the answers to those questions.
Thank you. Sorry to interrupt. Thank you.
It's worked well, and it gives you a nice snapshot of what you're dealing with every day. One of the things that I can talk about that other people have, we've had exposures at our centers. We have 3 centers. As I said, we serve medical communities. We serve both, Johns Hopkins, University of Maryland, but also community health organizations. During EPIC, we had quite a few families here whose parents worked for healthcare for the homeless, doing kind of on the street medical interventions. So it's probably not surprising that between our 3 centers, we've had 4 closures, and 3 of them have been for a positive COVID case. What I'm thrilled to let you know is, in each case, the screening questions worked, and in each case, we had no spread that we know of at our centers. The case stopped with an isolated case. So 3 positive test results. 2 were adults that tested positive over a course, but there was no spread at the center when we worked with our local health department. And the other case was an infant that tested positive for COVID. Her symptoms were very mild, mistaken for teething. But none of the teachers and none of the children ever exhibited any symptoms, and people did get voluntary testing after that because there were no symptoms and we had no spread that could be traced back to the center. So,
and Hilary, we also had a question, more than one question, about the questions that you ask parents. So I won't ask you to go through those now, but if you can share them with us, we can distribute them to participants in this webinar.
Yeah, we have a family, a father who had children who attended downtown Baltimore Child Care years ago, and he's a pediatric infectious health expert, and he helped us write the questions that help screen out, you know, is it this symptom? Is it a cough? Is it this symptom? Is it a fever? Those are deal breakers, you know, attendance denied. Or is it a combination of symptoms? And these need to be revisited all the time because the CDC is changing. I don't want anyone to think that our questions are the best questions and they will stay the best questions. They're not. There's something that evolves and emerges over time that, you know, in the very beginning, we were asking people, have you traveled out of state? Attendance denied. Then we changed that to, have you traveled out of state? Please let us know in case we have to do contact tracing in the future. So screening questions are just so key to making sure that illness doesn't enter your center, that contagion doesn't enter your center from the start.
And as you said, in the context of the relationships that you have built and are building, that's particularly important. Not that you appear to be a cop asking questions, but you're asking this for the benefit of their family, their children, and other children in care.
I think one of the important parts also is parents having the time to think about the questions. Parents are busy in the morning. They're under, especially if you're going to a healthcare field job or any job, it's extraordinarily stressful if you're trying to, our centers are infant through preschool, you know, get an infant off to care at the same time. So not having to juggle the baby, answer the questions, you know, all at the same time, but having time to think, ooh, did I give them Tylenol in the middle of the night because they were teething? You know, today is not a childcare day, if the answer to that.
Thank you.
I would also caution people to think carefully about siblings. You know, we don't mix groups during the day, but when we had our exposure, we had to close the whole center. Number one, I think that's the way they're doing it. But number two, their siblings in classes across the center. No matter how careful we are in our facility, those sibling groups do complicate contagion when you're thinking about contact tracing. So, you know, as Tracy said, you're very upfront when you're closing the center because you're awaiting test results. I would also encourage people to have their communication prepared ahead of time so that you're not dealing with the stress. Our positive case came on Memorial Day. I got a call at my house, you know, on the Monday of Memorial Day that an infant had tested positive. Having those documents ready, having your communication to families that you're going to change a little bit, but everything that you know that you're planning to say to families to reassure them, to letting them know what the schedule of communication is, having that done ahead of time is a relief. When we tell our families here, please look at closures with a when, not if mentality. That is a part of what we're doing now, is that we will be closed at some point in time waiting for test results, whether it's positive or negative.
And Hilary, can I ask a question? Since you care for such a large age range of children, several questions have come up about social distancing and infant and toddler classrooms. Can you talk about that just a little bit, please?
Sure. The way that we have approached social distancing for infants and toddlers is through group size. So keeping group sizes very small in order to control who's interacting with whom. Infants absolutely and toddlers absolutely need a quality of care that makes social distancing impossible. But that doesn't mean you can't put other controls. Who's entering the room, what parent is dealing with what, you know, what situation at home, and making sure that we are rigorous in our centers of not visiting one another in each other's classrooms, not, using the hallways too much, especially in our infant and toddler rooms, using the telephones as much as possible to communicate, not having a runner to take the kids back and forth. The caregiver walks from the room to the parent, receives the child, and then, walks back to the room. You can't ask infants and toddlers to social distance, but you can create an environment where you're controlling for things in similar ways to social distancing.
Thank you, Hilary. So we've had a number of questions, and I passed on several to Drs. DePinto and Drs. Perry. If you can rejoin us for those questions. There were three specific questions that came up. One that we've talked about a little bit already, which is children in face masks. And I wonder if you have any more information for us on that particular topic.
So this is Dr. DePinto. I think that the examples of the challenges of having children wear cloth face masks in childcare were very well illustrated by the colleagues here on the panel. One of the things that there are resources about is how to teach children to not be afraid of face masks and how to teach children to appropriately wear them. So there are those resources that I believe will be made available to you all from MSDE in a training that they're developing. The other thing is that parents really greatly influence whether or not a child will wear a cloth face mask carefully and safely. So part of this is being able to make sure that parents are working at home with their children around the issue of wearing cloth face coverings. The other thing that Stephen put in as a question was an apparent difference in the recommendations around the age in which children should be wearing cloth face coverings and reference to a particular county where someone said that a couple people in the county said that children starting at age 3. And so what I would say about that is that the CDC is pretty clear that under age 2 should not wear cloth face coverings. So children under the age of 3 can wear cloth face coverings. When we developed our guidance, we were trying to balance that recommendation with the realities that you've already heard about here. And when it comes to the issue of whether or not a particular county executive, a particular county health officer has the discretion to change the state's guidance and say children in childcare down to the age of 3 should be wearing cloth face coverings, that is something that you will need to check with your local health department about. But again, our guidance is based on sort of the practical balance between what is recommended and what we think would best work in a child care setting. Dr. Perry, I don't know if you have any additional comments on that.
No, the only other thing that I'll say is that, as I mentioned, the guidance really addresses a lot of the issues that folks brought up. Some kids, younger children in particular, cannot wear them safely and consistently. We don't want kids to be taking them off and putting them back on and taking them off. So if no matter what age the child is, we do recognize that there are some kids who cannot wear them safely and might be at risk of more contamination with the way that they're dealing with them. So absolutely, take a look at that guidance. There also, we never would force a child to wear a face covering if they were not comfortable to do so. And then there's clearly some kids with medical issues. I think that was brought up, allergies and asthma, who it may not be safe. So we really try to take all of those things into consideration in terms of our recommendations about the face coverings.
Thank you. And if you look in the chat box, what you'll see is there are links to that guidance that MSDE has, both in English and in Spanish. And Dr. Perry or Dr. DePinto, if I can also, because this came up, also ask this question, and we've touched on it, and it was difficult even before COVID-19, but several questions have come up about excluding children for colds. I just wonder if you have a little bit of guidance for that in terms of differentiating.
So that actually has been one of the biggest challenges around the issue of addressing COVID in young children. And we actually are in the process right now of updating some of our guidance to be a little bit more clear about that. And since that guidance is not final, I'm not going to necessarily share with you what the guidance will be, but what I can say is that we do recognize that to be an issue. We also have noticed, and I don't know if any of the providers who are on the panel had this experience or not, but in some cases, the child care sites requested the children be cleared by their physician, or at least saw their physician, for the physician to make that determination. Because what we don't want is for childcare providers to be in the business of making decisions about whether or not something could or couldn't be COVID. And so our updated guidance should be a little bit more clear about what to do with the common colds and runny noses that children often have. So I would recommend that you all kind of stay tuned for that updated guidance. But that, especially now with allergy season kind of ramping up, that clearly has been an issue. And the healthcare providers and pediatricians have played a very large role in addressing those issues for childcare providers.
Great, thank you very much. And if I could bring Amani back into the conversation, one of the questions that came up has to do with ratios, group size, and social distancing. And obviously, both the Department of Health and the Maryland State Department of Education have been very clear in all the stages that we've gone through about how many adults with children, what the group size is. But this question also begs the piece that given that we're monitoring children for health concerns as well as staff, are there challenges in the adult-child ratio or the group size and being able to staff that? Amani, I wonder if you have any perspective on that.
Yes, of course, there are definitely challenges with the group size and ratio, and even and just as a side caveat, even though the state moved to phase 2 in Baltimore City, we were still at phase 1 for a while. So even in phase 1, though, that there were challenges with the child to staff ratio, simply because we could have up to a certain number, 10 children, but if you had if you had 6 2-year-olds, then you had to then figure out how do you manage that and be able to pay that. So the finances that get involved in this whole ratio and where we are and what you need because of our normal ratios for child to staff, you still had to adhere to the regulation, but also deal with the guidance and just understanding how the two of them work together, or sometimes they contradict each other. At times you felt like, what do we do? So I personally didn't have that, but when I was listening to Hilary and she was talking about the group size for her infants, and I don't do infants, I do 2 and up. I know that infants, you got 3 to 1, but do you make that ratio even smaller? And if so, then you're still looking at how do you pay for the additional staff to try to manage that. With the number of staff we had in my center, like I had 12 children enrolled. So technically that would be 2 rooms, right? Because you only can have 9 children and 1 staff person in there. So it was 3 of us as staff here though. So that put my numbers down even lower for the total amount I really could take with 2 rooms being approved to be EPIC. So instead of being able to have 18 children, I think we only could have 17, but we only had 12. We never had 12. We rarely had 12 all in one day. Many times with this program, they did not show up. So it wasn't too difficult for me, but I'm sure at the other centers, depending on their enrollment and their attendance per day, it really does get tricky. And it's tricky because depending on the numbers that you have and your ages, if you don't have enough staff, then you really run into a major problem that day. And how do you fix that? And again, I can't speak to it directly from me because I didn't have that issue at this time. But as we moved up to 15, I potentially may see that as one of my issues. Like I got parents calling, when are we coming? Is it all right for us to come back? And we have the space, but then it's like, do I have the teachers to bring the students back in? And since we don't get the EPIC payment anymore, just trying to make sure we can have the funding to pay that teacher is a part of that whole ratio piece. That is a real stressor for everybody.
And I think, as you mentioned at the beginning of your comments, You are on several work groups. I know that we run into each other virtually on these work groups. And if our participants aren't aware, there are providers working with MSDE about recommendations. And certainly what MSDE did recently regarding group size is one way to try to help childcare providers. The other piece that we push is there needs to be much more in terms of resources that are given to childcare providers. This was needed well before this pandemic. It's needed now. It's going to be needed in the very short future. A quick question for each of our panelists. Amani, do your teachers wear face masks all day?
Yes, my teachers do wear face masks all day. When they do take a break, they do take their face mask off. I have one who, when we go outside, she will take it off outside for a short period of time. Because outside, you know, they're saying if you're outdoors, from what we understand, and if that's incorrect, they can let me know. But from what I understood, if you're outdoors, you don't have to keep your mask on, because the thought is that you got air flowing, it's a continuous flow, and you don't have to worry about it. You've screened everybody that morning of. So, but I wear my mask even when I'm outside. I just wear it all day because I'm just used to it. But if I could,
I've seen you wear them sometimes during phone calls.
I wear them on phone calls. I've been on the news about issues with face masks. But to that point, and I know Tracy and Hilary can agree, not only is there the expense of the staffing person, but then it's the PPE we need and don't have access to. So I'll let someone else speak.
Hilary, I know you gave us a virtual yes that your teachers wear face masks all day. Anything to add to that?
They do wear face masks all day. They prefer the ones that were also made by other staff members. We paid some of our staff to telework at the very beginning of this, and one of the options was sewing face masks. And we've gotten some really generous donations as well from some fabric stores and organizations here in Baltimore.
Great. How about you, Tracy?
I would say not all of them. Some of them do, some of them don't. We have some that actually have, you know, anxiety, and it actually increases their anxiety to have the face mask on. We've told them it's best practice, and we've actually supplied face masks. I bought at least 3 or 4 different types of face masks, trying to find the ones that are either, you know, initially it was like the most protection and the most comfortable. And now it's, because it's summertime, they're really hot, especially when you wear them outside. So trying to find one that's not as hot, but still protective. So we're constantly on the look for face masks. And while we clean mostly with bleach and water, we also use the disinfectant wipes for a lot of common areas. So we're on the search for that. So that's been challenging.
And I know for people like me that wear glasses, the face masks are an added impediment. So we are interested in participants' feedback on this, including any questions that you have. We'll put this in the chat box. This is a Survey Monkey. There are just 4 questions. We would ask you to fill that out and give us some feedback on what you thought of this. This is the email address that if we have not been able to get to your question, we would ask you to use this. We only had an hour. I suspect we could have probably done 5 or 6 hours worth and still not gotten to everything. So we appreciate your patience on this. We do want your feedback. Again, if we weren't able to get to your question, we apologize. Please send us something at this email address and someone will get back to you. Again, certificates will go out by July the 10th. If you have stayed on for the whole piece, again, this is the email address to let us know of any issues. And I would ask everybody to virtually give thanks to all of our panelists. They took their time, they provided their expertise. Hopefully you've found this helpful. Dr. DePinto, Dr. Perry, thank you very much. Hilary, Tracy, and Amani, thank you very much. This has been most helpful. I know I've learned a lot. I'm sure other people have as well. So thanks to all of you and good night to everybody.
Thank you.
Bye now.